Welcome back, ladies and gentlemen, to the Aches, Pains, and Gains podcast. I'm one of your co-hosts here, Thomas. I also have
Dan the man to Thomas's right.
back in the seat. We got a very special episode today, folks. But just before we get to that, please rate, like, share, subscribe wherever you're listening to. You can visit www.bridgecitybarbell.com for all your coaching needs, or follow us at Bridge City Barbell YXC on Instagram, or at Aches, Pains, and Gains .podcast on Instagram as well. Today, we are joined by a special guest. It's his first ever podcast. We got Dr. Rob Cutting. How you doing, Rob?
Excellent. How are you?
Doing pretty good, man. Doing pretty good myself. Rob, could you tell the good people who you are, what you do, that kind of thing?
Yeah. So I'm a chiropractor here in Saskatoon. Me and Thomas met when we started. Actually, we met before we worked at Mackey Physiotherapy.
Yeah, I was hurt, and then I came to see you for something at some point in time.
Yeah. But now we work together, and been a good time. Been a lot of fun.
Yeah.
And then I know Danny through the fitness world as well.
Yes.
And then, just a chiropractor doing his thing here in Saskatoon.
Heck yeah, man. Which is exactly what we're going to talk about here today, folks. What is a chiropractor? We're going to break it down. We're going to talk about some of the myths. We're going to talk about some of the green and red flags of finding a good practitioner near you. But first, let's just get into it with our classic Aches, Pains, and Gains segment. We'll get Danny to kick this one off. Danny, you got any aches, pains, and gains to report?
Nothing crazy. Kind of, post moving into the new house and post Westerns and everything, training kind of definitely took a dip. But this last week, it finally feels like I'm like back in a groove. Like I have that like motivation to get back in the gym. I want to go and train again. I want to, put some weight on my back. So I take that as a huge win there. Nothing injury to report. Everything's feeling really good. Like I said, I'm feeling good back in the gym. I brought my stance in a little bit, my notorious wide squat.
Yeah.
Brought it in a little bit. Feels pretty good. We'll see where it goes. Shoulder, healthy, 100%. No issues there. And
all gains, no pain.
Dude, that's what I'm saying.
That's a good place to be.
Exactly.
Nice.
Yeah, that's it, bro.
Sweet. All right.
Ride the wave.
Yeah, ride it out.
exactly.
It's nice when you have those phases, right?
Yeah.
Because, they're always, they're fleeting.
Yeah, I know. So I think the biggest thing is like there's no stress.
Yeah.
No more stress in my life. So,
Yeah. So, Rob, what Danny decided to do to himself, just to give you a bit of context, he decided to compete at Westerns and cut into that competition, right? But while doing that, he got a notice, like a month notice, to move out of his former like renting agreement or house, right? So he had to move, pretty short notice. And then within about 3 weeks, they bought a house and had to move again. So while cutting and training and peaking, he had to move twice.
Bro, I didn't make it easy on myself. It was bad.
Yeah. Plus, like when you're moving, it's hard to control your food,
Yeah.
like,
Oh, fuck. Dude.
Well, no time to eat, so easy peasy.
My diet was like fast food, like McDonald's and Burger King.
Yeah. Fair enough.
That's
Yeah.
good.
But yeah, now he's doing pretty good, which is good.
Yeah.
What about you, Rob? Any aches, pains, or gains to report?
Yeah, I guess. Well, I'm glad you're doing good, Danny. But
Well, thank you.
I'm kind of the opposite side of the spectrum.
Shit.
I'm a little bit of a slump right now. No big woes. Like I'm not too hard done by. But I've just been having this like nagging, kind of almost like groin. I thought it was like initially when I started having it, I thought it was like either my hip flexor, like a tendinopathy, or some sort of like ab insertional issue.
Yep.
Like, so I started going down and I started looking at these things, and I actually had a buddy of mine with similar issues earlier this year, and I helped him out to diagnose that. Basically, as soon as you start having pain in like the inguinal region, you start to worry about like hernias, right?
Oh yeah.
So, I mean, having the information I know and being educated in the way I am, I start like going down this like, spiral.
Yeah.
And you're like, worst case scenario, okay, hernia.
Yeah.
How do we rule that out? Let's get an ultrasound. So I went to a buddy of mine in the city here who was also a chiropractor, and I was like, look, I don't need too much manually. I'm not coming to like get treatment and stuff like that. I just literally need you to get me an ultrasound rec, and then like I'm gonna go get this done just to rule that out. Give myself like peace of mind, so I know whether to just like load manage or if other stuff has to happen, like meshing or something like that.
Yeah.
So I can continue to train down the road.
Yep.
So got that done, cleared, nothing wrong, no issue. In my head, start to feel a little like a bitch. Like, why is this bugging me so much? And like, whatever. Main things that were aggravating were basically like, if you were like in a hollow body position, like imagine like a hollow body rock, just searing, ripping, burning pain, like right in my groin. Ugh. Yeah. So chalk it up. I started to go down the route. I started to think like, okay, could this just be like a sports hernia, which are really hard to palpate and diagnose?
Yeah. And it's different from an actual hernia as well.
Yeah. But kind of came to the conclusion, like some people call them sports hernias. Some people call it like athletic pubalgia. But essentially it's like an ab injury where it inserts in my pelvis. And then anytime I load it, it's pretty sensitive. It sucks. So yeah, that's kind of been going on. I actually was doing pretty good. Like it started, I can't, and then like classic, like I can't remember a mechanism. I don't remember doing anything severe. Yeah. Just probably repetitiveness and too much load to that area, and something started to get pissed off, and it's like, okay, let's get you to dial things back a little bit for a bit.
Yeah.
So I was doing pretty good, and I was having this going on. I was just working around pain, staying away from things I couldn't do, which is essentially like the main way I kind of train on a day-to-day basis is CrossFit.
Yep.
So certain movements of CrossFit I couldn't really do because they just put too much load in that area. Surprisingly enough, like toes to bar were fine.
Oh, interesting.
So, which isn't technically like kind of like an ab or hip flexor exercise.
Yeah.
Those felt pretty good. The biggest tells were I couldn't do like single leg loading, like lunges.
Oh.
So lunges or Bulgarian split squats, just
a
lot of pain, no power, felt weak.
Yeah.
And just that tearing sensation, right? But GHDs were for sure like that eccentric load to your core.
Yeah. Oh yeah.
Just the worst thing. And then it started to get to the point where like any sort of like lumbar extension, I could like poke at it.
Yeah.
But that's something that's been kind of limiting me. But it was funny because I think it started back in like June or July. Cause I remember looking at, I went for that ultrasound in July, cleared everything out. And then I was just like, okay, give it a few more weeks, work around it, keep being active, but don't do things that piss it off.
Yeah.
A little bit of relative rest, we'll call it, from aggravating activities.
Yeah.
And I actually competed in a competition in the middle of all this, felt fine.
Yep.
Did like 5 workouts in 2 days and no issues. Even after the competition, didn't feel like I agitated it during the comp, didn't feel bad at all. And then I just woke up one morning a couple of weeks after that and I could not get out of bed.
Interesting.
Like I couldn't sit up.
Yeah.
I had to like kind of do the whole like wiggle and maneuver and roll over.
Yeah.
I was actually supposed to go to a hunting blind with my father-in-law.
Yeah.
And I had to like text him and be like, I can barely walk.
Yeah. Yeah.
I don't know what's going on. So then I started to think like, okay, did I do it worse this time? So then again, text my buddy, get me an ultrasound, checked again, still good. But the reason I went for the second ultrasound was because on the first report, it stated like, if symptoms persist, you can book in with one of our like musculoskeletal specialized ultrasound techs.
Yeah.
So someone, I guess, who deals with things like this more often.
Yeah.
So kind of did that. And then I feel like she did a very thorough job and gave me peace of mind.
Yeah.
So I've just been maneuvering that still, giving it a bit of time and training around it essentially.
Yeah. Navigating aches and pains.
Exactly.
It's another phase of training. I heard someone once call it.
Yeah.
It's just you move into that phase every now and then you just work your way through it. And then eventually you just don't even remember you being there in the first place.
The fun thing, an interesting thing about like CrossFit in particular, there's so many movements and so many different things you do that it is easy to modify workouts to continue to be active, but in ways that feel good and avoid those things that feel like really bad. Like say I went to the gym and then there was a workout with GHDs and I knew I couldn't do it.
Right.
There's endless things I could do to substitute for GHDs and still be active, right?
Yeah. Oh yeah. Yeah. I've always found like being injured has always wound up. You okay there, Dan?
I'm good.
Do you need a second?
No, we're good.
Just get it out, man.
I'm good.
You need some water?
No, we're good. We got it.
Do you need first aid?
No.
I'm just checking.
We're good.
He's just choking.
I was trying so hard to Be quiet. Be quiet.
He's just sitting there. His face is red.
Every time I say CrossFit, he gets choked up.
Yeah,
and
that's right.
feels a little sick.
Yeah, he kind of gags a little
we're
bit.
good.
Yeah,
We're good. I got it. Sorry.
Yeah, I was gonna say, like, every time I go through like some sort of phase of injury, makes me like a better coach and clinician on the other end of it, because you gain like a little bit of empathy, but also some insight in like, oh,
Yeah.
if this helped me, I can potentially communicate that in a way that can help another client or an athlete or something like that, right?
Oh, actually, I got another funny story. I had a full blown S1 radiculopathy earlier this year.
Oh yeah.
That was an interesting experience.
Real quick, Rob, just outline for the folks what an S1 radiculopathy is.
Okay, so this would be
Thank you.
people. This could be an example of like someone who actually comes into the clinic and says like, "Oh, I'm experiencing like sciatica type symptoms." Radiculopathy is like irritation to a nerve root, like one specific nerve root. In my case, for example, this being the S1.
Yep.
So most likely situation was I may have some sort of like asymptomatic disc herniation in my lower back, maybe L5 S1, and I did something. I can't remember how I even set this off. Again, I don't know. I don't remember a mechanism, but I do remember the symptoms and being like, "Oh, this is actually like textbook." And this like, I feel like this never happens.
Right.
But experiencing that, I was like, "Oh, this can happen."
Right.
Because like if you look up like S1 radiculopathy, just like even Google it or look in a textbook, you'll see a specific like pattern where that S1 nerve root innervates in your lower limb. And I had like numbness and weakness in that entire area.
Right.
Like I couldn't do a calf raise with my own body weight, double legged. I could kind of do.
Right.
Single leg, I couldn't even get my heel off the ground. It was,
oh wow, yeah.
It was crazy. It was just weakness.
Yeah, for sure.
So it wasn't so much the pain that was limiting me. It was more like I couldn't do things.
Yeah.
But that was like you said, like it helps you empathize with people.
Yeah.
I was like, this is wild. Like when people describe this to me, like I'm not just gonna be like, psh, like brush it off kind of thing. I'm like, wow, this is 100% how this feels.
Oh yeah.
Yeah. So that was a neat experience. I've fully recovered from it. I'm not having any issues anymore. No weakness. I just gave it a bit of time and essentially like rehabbed.
Yep.
Kind of the same thing I'm doing with this athletic pubalgia thing.
Yep.
But that was a cool experience.
Yeah. And in case folks are wondering, the majority of disc bulges and herniations and radiculopathies do tend to resolve eventually and heal. So people get kind of scared whenever it comes to the back or the spine. They're like, "Oh, this is it. Like I'm done." Like I threw my back out. I'll never walk again or never play sports or whatever. And it's like, oh no, you just need a little TLC, a little rehab, progressive loading, and you'll be all right. You know?
It's kind of funny. So like, I've hurt my back so many different ways over the years.
Oh yeah.
I grew up playing football, rugby, contact sports, tons of fun. I actually got out pretty unscathed. I think from those sports, the worst things that probably happened to me was like I had a sprained wrist once.
Oh yeah.
Like maybe I'm lucky in that sense.
Yeah.
Definitely had my bell rung. Maybe some undiagnosed concussions.
Yeah. Oh
But like, I mean, being young, playing sports, didn't fully go get assessed at the time.
Yeah.
I sometimes like will tell people about my own injuries and my own experiences with injuries to help like reassure and educate them that like just because you hurt yourself doesn't mean you now have a bad back.
Yes.
Like I can easily think of 4 times I've hurt my back to the point where I've like been debilitated and couldn't walk.
Yeah. Oh yeah, for sure.
But to this day, I still do everything I want to do. I mean, I sometimes tell people I have the education behind this to give myself the confidence to understand these things and not like be too concerned.
Yep.
So that kind of puts me ahead of the curve, but you can definitely get injured and fully come back from that and keep doing the things you want to do. 100%.
Yeah, absolutely. Yeah. Just, takes time. In the clinic, and with clients all the time, I use my injury experiences just to highlight like, hey, here's some realistic expectations. Cause I remember someone that was like, why does my knee still hurt? It's been 6 weeks. And like in the world of rehab, 6 weeks ain't that long. And he's like, is it just because I'm getting old? He's in his 40s or so, whatever. And I was like, man, I'm 27. I hurt my knee in January.
Yeah.
It still hurts. It's been like 11 months. You know what I mean? Like, and they're like, oh, really? And I'm like, yeah, man. Like that's just sometimes injuries don't recover on the timeline that we expect, depending on what it is, obviously, right?
Yeah, 100%. Different things happen at different times, and even different people recover at different rates.
Yeah,
based on different like prognostic factors and stuff like that. That's a funny one. It's always like, oh, I'm getting old.
Yeah,
that's the fallback. Immediate like excuse.
Yeah. I'm always like, everyone ages and things do change as we age for sure. Right? Whether it's recovery wise or just life wise, right? Stress factors, all those things tend to change, right? But at the end of the day, I always say you get to choose what that looks like, in terms of aging, right? Because if you look at a 70-year-old that's really active and a 7-year-old that's not very active, there's a very stark contrast between the two. You know what I mean? And then it gets more pronounced, I feel, as they get older as well.
I love all the stuff. Like there's so much like stuff coming out on like health longevity these days.
Yeah. Oh yeah.
Like all the, Peter Attia stuff and all that research
just
and work.
Move your body. Yeah.
That's a big piece of it. There's actually an image that lives like rent free in my head. I actually just show this to a lot of people sometimes when I'm trying to like get this point across.
Is it a triathlete one?
Yes.
With the muscle mass, the MRI?
100%.
Have you seen this picture, Danny?
Yes. I know the one you're talking about.
Yeah. Where it's like
they're both like 70-year-olds or something. They're both the same age. And
yeah.
I know
so it's like I don't know, it might be like say like a 40-year-old triathlete's leg.
Yeah.
And then 2 7-year-olds, one who's like become more sedentary in life and one who's remained active in life.
Yeah.
And there's not much difference between the 70 and the 40-year-old's leg. But then the sedentary leg is more like, you have fatty infiltration into the muscle. There's atrophy, probably, I mean, you can't see it from the image because I think it's like an MRI slice.
Yeah.
But there's probably like, bone density decrease in the sedentary individual and all that kind of stuff.
Oh, yeah.
Yeah.
That picture, rent free in my head.
I have that favorited in the clinic and I pull it up pretty frequently actually because it's like, so like here you go. Like the proof is in the pudding kind of thing, right?
Yeah.
Heck yeah, man. Any other aches, pains, or gains to report, Rob?
No.
Good summary?
No.
Heck yeah.
Just hoping I can shake this this one that's going on right now, and it will eventually go away.
Yep.
I just need to continue to manage my expectations and work around it and do things that feel good. Like last week I ran 3 times.
Yeah.
Because running felt good.
Yeah.
I hate running.
You got to find what you can do though, right?
Exactly. But I was like, it's movement. I'm loading it to some degree. It's tolerable. I can do this, so it's good for me.
Yeah. Yeah. Absolutely.
But I don't have to go and like, beat my head against the wall and do GHDs and Bulgarian split squats until and just like trying to force feed my ab injury to participate.
And there's a time and a place for that. I empathize a lot. I've talked a lot about my ongoing knee injury that I've gotten an ultrasound from you for and everything like that too, right?
Yeah.
And I've talked a lot about that. It's like trying to determine whether you should just like slam it and push through to see if your body can desensitize that region, or if it's actually like a situation where you need to like back off and give it a little rest and then kind of go back to it. And it's so hard to, walk that line sometimes, especially when it's you and you're trying to work on yourself.
Yeah.
Because I don't know if you ever experienced that, Danny, where you're like, I don't know if I should push through this or just,
There's definitely a lot of times dealing with my shoulder in the bench press. But like, I don't know, it's hard because like the sport, powerlifting, it's the third of the sport, right? Bench press.
Yeah.
You can't not do it.
Yeah.
And even though I would be like way less than what, like the load, way less than what it should be, I would still push it to the point where I was like, hey, this is like slightly uncomfortable. We'll stay here. We'll be able to get some work in.
Yeah.
But
keeping it tolerable.
Yeah.
That's
green, yellow, red.
Yeah, you ever heard of the green, yellow, red zone or
I have
red light
an
analogy?
idea what it is, but go ahead and explain it.
Well, I use it a lot with people. Like it's so handy because it's like as long as you do the activity and you recover shortly after and you keep it within a tolerable range within, I'll say like immediately after to 24 hours after, as long as it's in that green range where it's tolerable, even kissing up into yellow, we're still okay. If the symptoms were to increase to like the red zone where it's intolerable or the red light area for an extended period of time, that's how your body's like telling you like pump the brakes a little bit here, brother. So it's handy. It's a great way to use or a great tool to use to navigate it.
Yeah, because the one thing wanting to compete at the highest level, obviously when something's like holding you back, that's very like detrimental, right?
Yeah.
But also just being injured in like day-to-day activities.
Oh yeah.
It makes if you're dealing with like an injury and you just can't move and perform and do all the things you want to do at the speed you want to do them and like run through life as freely as you'd like to, it makes everything difficult.
Oh yeah. Yeah.
Like Yeah, like getting in and out of my car was a challenge for a time.
Oh yeah.
Just because I was in like a deep hip flexion position and then pushing off my leg to get out.
Yep.
Like you're just like, it's like constant reminders of like, this is an annoyance and like, I don't like this.
And it's still there and you're still dealing with it.
Yeah.
It's me and stairs right now. I have to like hobble going down the stairs still. Like it's like ongoing. So yeah, I mean, when it comes to like my own aches, pains, and gains, like the ultrasound came up clear, right?
Yeah.
Which gives me some reassurance that like maybe I'm okay. The problem is if it's like a deeper structure that I injured, like an ACL, like the inner meniscus, things
you
like
need
that.
More specific imaging for that.
Yeah, you need an MRI for that kind of thing. But I'm not bad enough to need surgery, so it wouldn't change my treatment approach. So I don't need an MRI, right? It's kind of the way I view it. And after seeing people go through like whatever ACL or meniscal surgeries, I'm like, man, unless like that's the last option on the table, I'm gonna do everything else other than that. You know what I mean? Because
100%. And you can treat those things conservatively. You don't need to rush to get a surgical intervention to fix that.
Yeah.
And you also shouldn't chase diagnoses with imaging.
No.
A lot of the time.
Yep.
Sometimes there's a time and a place. I mean, I tell a lot of people, unless you're chasing down like red flags.
Yes.
So like, meaning like, I don't know, what if it was a traumatic mechanism, like say they had a rollover accident in a car and they have neck pain now or back pain. It's like, okay, let's make sure nothing's broken before we go and start like treating you manually or like, make sure you're in the right place to get the right treatment at the right time.
Yeah.
If there's a fracture, that's like, you need to actually get that dealt with.
Yes.
Then let's get you that first.
Yep.
Because obviously, you don't want to do any harm to the person.
Yep. Yeah.
But outside of fractures, you'd be thinking like tumors and infections.
Yep.
But there's a lot of pretty telltale signs that you can tease out when you think that stuff's going on.
For sure. Yeah.
I'd say most of the time, like for example, like when I got imaging, I was just trying to give myself peace of mind.
Yep.
Like I just want to know there's not a hernia, and then that's good enough for me.
Yep.
I don't even need it to tell me like a specific structure, but I want to know that I can continue to train around it. You know what I mean?
Yep, for sure.
So a lot of the time when people want imaging from me, from my experience so far, is like just that reassurance. And if they want the reassurance, and they're going to continue to like, it's going to help them stay active and move, then I'm happy to do that for them.
Yeah.
But I'm not using imaging to chase a diagnosis by any means.
Well, you get a lot of false positives, like 100%. Where you just find stuff coincidentally that doesn't actually contribute to your clinical like presentation or how it feels even.
Yeah.
And like, I didn't know that was going on in there. Like, it's like if you image like Danny's back here, you'll probably find some like disc bulges that are asymptomatic. You'll probably find some arthritis in some of the joints and like
little lumbar facet arthrosis for sure.
Yeah. Oh yeah.
You got all these problems, man. You don't even know about it.
It doesn't even bother you day to day. Yeah.
And later in life, oh my God,
you're out of sight.
You'll have even more.
You're gonna
of that.
You are gonna pay for all those. No, I'm being sarcastic. If you can't tell,
it's something like over the age of 20. It's actually a fairly high percentage of people that if you like MRI'd their spines, you'd find bulges, and it just increases with age. And like around like 50 to 60, it's something like close to 60%, I think.
I remember reading a paper once on imaging. I think they were specifically focusing on X-rays, I believe.
Yeah.
But they were like, you'll see like degenerative changes, whether it's joint or disc. Arthritic changes. Say you imaged 150-year-olds, 60% of those people would have those sorts of like normal age-related changes on an X-ray.
Yeah.
Jump another decade up to like 60-year-olds, same 100 people, probably that percentage probably jumped to 70.
Yep.
Go to 70, probably jumps to 80. It probably jumps about 10% every decade, right?
Yeah, and these are asymptomatic people. No symptoms.
Yeah. So you can't create a relationship between imaging findings and pain. It's a very poor thing to do. It's very poor healthcare, if you ask me.
Yeah. If you just throw that at everything. And it's one, like it can be used as one part of the tool, but it's not like the whole toolbox, or one tool, but it's not the whole toolbox. You know what I mean?
Yeah. Like I said, like if you're using it for patient reassurance, just to help them understand there's nothing severe going on.
Yeah.
Good.
Yeah. Like I had a client like that fell out of a tree and like landed on a branch, like on his back. And he's like, yeah, my back's been like really killing me. And I'm like, how far did you fall? He was like, about 5 feet. And I was like, onto your back. And he was like, yeah. And I was like, I'm not surprised your back hurts, but before we do anything, you gotta go get that X-ray. Like, like I was like,
shit, dude.
He was like, I was like, did you go to the doctor? Like, did you get an X-ray yet? And he's like, no. I was like, so that's the kind of thing for sure you want to get checked out ahead of time. And then he was all clear. And then we started, loading, appropriately, and then got him moving and grooving to the extent we could. And, he's doing a lot better now because of it. Right. But
perfect.
that's an example, right, where you should use it in that kind of circumstance. But Yeah.
traumatic mechanism, possibility of something serious going on.
Yep.
If you had like, point tenderness pain, high level of pain.
Yep.
Yeah. Rule it out.
I'm glad we got to the imaging conversation because I didn't put it in the outline, but I'm glad we started talking about it because we haven't really dove very deep into that before. Hey, Danny?
No.
Did you learn something new?
Yeah.
Heck yeah.
There's a lot of asymptomatic
People
stuff going on.
Yeah.
I would love to see what's going on with mine.
Yeah. And then just like not have any issues at the time. Yeah.
I mean, I don't
Danny,
know.
ignorance is bliss, buddy.
It's true though. Because some people actually like their symptoms get worse.
Once you see an image, you can't unsee it. And then you start saying like, oh, I do have like that L5 S1.
God, now my back is starting
lumbar
to hurt, actually. Fuck.
arthritis, and you're just like, am I? Yeah. So that's another reason I don't jump to imaging because it's like once you show someone it, they can't unsee it.
Yeah.
And that can sometimes, again, like that picture of that triathlete, live rent free in their head, and then the worst thing you want to do is like demonize things like that because there's an extremely poor relationship or correlation between pain and someone's imaging findings. People can have like perfectly clear imaging. Like they could like say it's a knee, like for example with you, your knee could look like the best knee ever, but you could have tons of pain, right?
Yes, for sure.
Versus someone could have a very like arthritic knee with like, things like degenerative changes and whatever.
Osteophytes or weird, that just means weird bone growths related to age.
Yeah. But they might have no pain, right?
Yeah.
So you can't say like one thing leads to another. It's very just bad way to practice.
Yeah, pain's way more complex than a picture. We've talked about the complexities of pain a couple of times, and it's like it's hard to wrap your head around unless you've kind of gone through some of it or someone's tried to sit down and like explain it to you. But
did you ever, when you were in school, did you ever hear about like Lorimer Moseley or David Butler?
Yep. Yeah. Lorimer's like he's good stuff.
Like Explain Pain and Explain Pain Supercharged.
He has if the folks want to check him out, Lorimer Moseley has a YouTube video called Why Things Hurt. It's a TED Talk.
So good.
Phenomenal. They explain
the snake bite.
Yeah, the snake bite analogy. I think I've even talked about that on here before. Where like he was, do you remember that one where he's like walking through the bush and he gets bit by a snake, but he thought it was a stick originally.
Yes.
And then he almost dies. Yeah. And the next time it was a stick, but he's in the most pain imaginable.
A poisonous brown snake. He's an Australian, I believe.
Yeah.
So Australia's got all sorts of poisonous stuff down there.
Yeah.
But yeah, he gets bit by a snake, doesn't think much of it, but then like passes out and then wakes up in the hospital like
ICU and the whole gambit.
A week later or something like that. I can't remember. It's a good video to watch. It's awesome.
Yeah.
But then he's going out in the bush and then he's like walking through the bush and then like a stick just like hits his leg in the same spot and he like is crippled, falls down and is like wincing in pain,
screaming
because of that experience he's had where he got bit.
What?
Yeah. So he's
my God.
his body's like hypersensitized to like something going on there.
Yeah.
And it was like an overreaction. Or have you ever seen the people who like they don't know what they're touching in the box?
Yes. Yeah.
And they're like super scared to touch it.
Yeah.
Those are really good examples of how like your expectations or like fear can make you feel like nervous or like pain, right?
Oh yeah, for sure.
Oh, they're great examples.
Yeah, it's like that's where like to apply to the gym, if you have like say for example the back squat has been routinely bugging your knee, right?
Yeah.
You might just have this expectation that the back squat is going to bug your knee.
Mm-hmm.
And so it does. It bugs your knee. Even though there's not anything like fundamentally wrong with the knee itself, like the structure.
Yeah.
It's just because those tissues have become sensitive and there's actually some like neurophysiological changes at the nerve level and in the spinal cord. It gets better at sending those pain signals where your threshold that needed for the pain signal to shoot off actually lowers and lowers and lowers, almost like your body is, trying to like protect the region as much as it can because it just creates this alarm system and it doesn't always correlate well with damage, but it's trying to protect you essentially, right?
Yeah, that's a great analogy. That's something I talk to people about all the time in the clinic, is like pain is your body's like alarm system, right?
Yeah.
Like it's actually a built-in protective mechanism.
Yeah.
Pain can be different and mean different things, right? Like you break an ankle, like your alarm system's on haywire, right? You're going to be in a lot of pain.
Yep.
But that's different from just like if you get like pain from say like exercising and hitting like a certain like rep number and you start to like feel like aches. Like that's just your body like giving you feedback and saying like, okay, you're maybe pushing it a little bit too far. You might need to want to put the governor on a little bit.
Yeah.
Stay out of that red zone. Stay close to like yellow and green. But yeah, pain can mean different things. But I always talk to people about pain sensitization essentially.
Yeah.
In terms, because like I think it's pretty obvious pain's multifactorial. Things like your your sleep quality or even like your stress levels
Oh,
at the time
big time.
can impact your perception of pain, right?
Yep.
So sometimes I tell people it's like pain's almost like a radio, right? And when you're in times where you're not sleeping well, or your like sleep cycle's off, or you're tired,
Or you're moving twice in a month.
or you're moving twice, stress is high and elevated, then that like volume dial on your radio kind of gets turned up. So you can hear or you are more easily going to recognize pain in situations like that. But if you get your sleep under control, you get back into a good routine, you deal with the things that are causing you that excessive stress, you take less, like you take some things off your plate.
Yeah.
Then you can kind of turn that volume button back down. So like the pain signals are less loud, less obvious. So you don't notice pain as much, right?
Yep. Oh yeah, for sure.
That's such a great analogy.
The radio
That's
signal.
so good. Yeah.
It's more than just the issues in the tissues, right?
Sure,
There's a lot more playing into it. Pain should always be viewed as like a multifactorial thing, right?
Yeah.
But that helps people like to understand like, oh, there are other things. I don't try to do that to make it seem more complex to people. I try to tell them like, there's different ways you can attack pain.
Yeah, you have a lot of tools, right?
Exactly.
Is essentially what that means. Like, if you can take care of your nutrition, take care of your sleep, like all these little things, like the lowest hanging fruits, like, well, how much sleep you getting per night? Oh, 4 hours. Can we change that? Is that an option? Oh yeah, I could probably go to bed earlier.
Yeah.
Awesome. Let's try that. And then, you know, I always ask people, I'm like, okay, your hypothetical twin comes in here, same exact problem, same exact, you know, knee thing or whatever. One of you is getting phenomenal sleep, low stress. The other, high stress, no sleep.
Yeah.
Who do you think's having a better time?
Yeah.
Right. It's pretty obvious when you like lay it out like that, right? And they're like, oh yeah, I didn't even think about, you know, that could contribute to some of these things that I've been feeling. So yeah, it's a super handy way to kind of break it down for people.
100%.
Now, Rob, I love talking about pain science stuff, but I do want to get to the crux of the episode.
Right. Yes.
Let's kick it
get
off.
Back on track here.
Yeah. What is a chiropractor though, Rob? Let's define it, and then we'll kind of move from there.
All right. Chiropractors are basically trained to be neuromusculoskeletal experts. So any sort of, I don't know, pick your adjective, ailments, complaints, conditions, diagnoses to do with the musculoskeletal system. So basically muscles, tendons, ligaments, joints, or nerves. We are trained to assess those things and treat them essentially.
Yeah.
Right
on. Okay. And what did like the program look like when you were going through school? Even like a broad overview, right? Because I feel like a lot of people don't really know what it all entails, right?
Yeah. So there's different ways you can do it.
You need an undergrad first.
Most of the time. There's a short track like you can do. There are certain places. I actually think I heard about, I think the U of R is doing a short track because I grew up in Ontario, and there's a university out there called UOIT, University Institute of Technology or whatever like that. And they have this like fast track pathway where you take 3 years, you don't get your degree, but then when you graduate chiro, you get both your DC or your Doctor of Chiropractic and your undergrad at the same time.
Yep.
But most people will do like some sort of undergrad for 4 years, and then they apply to chiro, and then that's another 4 years on top of that.
Yep.
I'd say the majority come from kin backgrounds. I'm sure it's the same with physio.
Yeah, kin's the most popular. Yeah.
People who like, you know, the study of human movement and
exercise,
active people, like that's kind of goes hand in hand. So it is 8 years post-grad altogether for the most part. You can do it in 7, but there's also schools in the States that are only 3-year programs. The only school in Canada is CMCC, as far as I know.
Okay.
I think there is a small program in Quebec somewhere.
Sure.
But I don't know much about that. But yeah, you basically go, once you get your undergrad, you go to the school, do another 3 years of basically like structured learning. It's like pretty much full time. Like your schedule is pretty heavy. I remember early on, like one of the first times I sat in the lecture hall, and then I always find it hard to define these people. They're chiros, but they're also like profs. So
right.
Yeah.
And it's just instructing chiropractor.
Yeah. Instructing chiropractor. He goes, what we're going to basically do for the next 4 years is shoot you in the face with a fire hose of information, and you're just going to try and absorb as much as possible. Which in the first year, it felt like that for sure.
Yeah.
It's like, wow, this is way more intense than my undergrad. Feels like just overload information.
Just grinding.
Yeah. But eventually you get used to the workload and you figure out how to navigate it, and then you're pretty much smooth sailing. I felt the first year was just like, okay, if you get through first year, you're going to get through it. But the first 3 years are all like learning. You do technique labs, like you actually do the hands-on stuff and you learn everything from the start. Your fourth year is all just internship. So you do 2 6-month placements at 2 different clinics. There's a lot of like internal clinics at the school,
Right.
but then there's also like external clinics.
You kind of get to pick which one you go to, or
Basically a lottery system.
Oh yeah,
So,
similar to physio then. Yeah,
you rank. I think say there's like 20 clinics. You rank them in order, and then they just draw names. And then if your name is drawn early on, and your first pick hasn't filled up with, say, the 10 or 12 people that pod can take, you're in. Some people, I'd say most people get their like top 5 pick. But then, some people just get unlucky and drop way down and it's not what they expect. But I think everybody gets a good experience and a good learning. Yeah, good education. I definitely remember doing our board exams and feeling like this is a joke. Like the program definitely really prepares you well for being a chiropractor.
Mm-hmm.
But yeah, that's pretty much what the program looks like.
Sweet. Yeah. Okay. And why did you decide to become a chiropractor?
I've always been interested in the human body, how it works. I've always been like, sciences have always made more sense to me, like processes and stuff like that. So even when I was in like kin in university, I was taking like, there was a kin arts versus kin sci kind of arm to like what you could do. And I was on like the kin sci side. I did my undergrad at Western in London. But I think near the end of my undergrad, I was trying to figure out, okay, so like, what am I going to do with kin? Like, there's a few different options, a few different pathways. Am I going to go to physio school? Am I going to go to med school? Am I going to do chiropractic? Am I going to go into education? Maybe be a gym teacher? I don't know.
Right.
Like, there's a lot of different things you got to think about. Because it's funny, you don't really know what to do with a kin degree when you get done.
Yeah.
Because
So I was in the same boat. Yeah.
And I didn't realize that until you get out and you're like, oh, the heck am I going to do? Or like, I could have been like an athletic trainer, like, something with like movement and exercise or, but, so I ended up taking this course where you shadow different professionals.
Yep.
And I basically got placed with this chiro in London who was there's an additional kind of almost like a master's program at the, at CMCC where you can do a sports chiro designation kind of thing. It's another 2 years. You do a little research. And there's more than just that to it, but you become like a registered sports chiropractor.
Okay. Yeah.
In Canada. And this guy was one of those guys. So I was just shadowing with him and like kind of going through his day to day and stuff like that. And I kind of got like turned on to chiro that way. I was like, oh, this seems like a good profession, a good career. And I saw him enjoying what he was doing with people and his clients finding benefit from the things he was doing. So I was just like, oh, I guess this is something I could do.
Yeah.
Then applied, and when I was applying, you basically had to have a certain GPA to get considered, and then you went for a paneled interview.
Right. Yeah.
3 or 4 people sitting in front of you, and they gave you like competencies. I think initially, like 10 things where like find things to talk about or ways you've displayed like these 10 competencies. I think it could have been like something like healthcare advocate, leader. I don't know. There's like tons of different things. It was a lifetime ago.
Yeah.
So I don't really remember all of it, but did the panel interview, and then I guess they decided I was good enough, and then went to school and became a chiropractor.
Fair enough. And here we are.
And here I am.
Cool. Right on. Danny, any questions? How you doing?
Just along for the journey, man. This is great.
Okay. All right.
I'm learning so much, man.
Should we dive into some chiro myths and things like that?
Sure.
Yeah, or I guess just you can almost call it just musculoskeletal myths and whatnot, because they kind of go along with both. But people here probably have a certain image of chiros when it can vary quite a bit from practitioner to practitioner, right? And I think certain myths have maybe started or have been perpetuated from kind of the old school chiropractic, from my understanding. Of course, you can speak a bit more to that, right? But what about like things like subluxations, right? You've probably heard of like the subluxation theory, or people have heard of that before, right? What are your thoughts on that one there, Rob?
I've actually never heard of those.
Okay. All right.
What are they?
Well, that's the thing is, I I don't really know what the hell they are either, because I just heard a chiro talking on Instagram, or a few talking about these subluxations, and these are or almost like it's an issue with your alignment, causing problems with your movement. And if things are out of line, then you have to put them back into alignment, and that allows you to move properly, or something along those lines.
Oh yeah.
So I've heard it spoken about or like spoken or described that way in terms of the alignment. Do you have any thoughts on like the alignment issue or those types of things?
Yeah, for sure. I was honestly I was kidding. Obviously, like I know.
Yeah, I was like, I hope you know what I'm talking about. Yeah.
I know 100% what you're talking about. One thing I didn't realize when I went to chiro school was there's a big like dichotomy in the chiro world. Kind of like what you said, like kind of old school versus new school.
Yeah.
Different people have different belief systems. Different people have a different, I guess, understanding of what they are doing when they're, say, performing like adjustments.
Real quick, Rob, can we like define adjustments?
Adjustments are high velocity, low amplitude thrusts applied to a joint at its end range to release pressure from a joint. The research on that has been shown. What they hypothesize is that helps you to improve your range of motion of that joint. It may decrease a little bit of muscle activity or like, tension in the area. And if the joint is causing you some pain, it may give you a little bit pain relief.
Yeah.
Back to the subluxation thing though. I don't believe that's what happens.
Yeah.
I think it's more just we're releasing those gases from the joints.
Which gives you a nice satisfying crack.
Yeah, that sound you hear when, say, you crack your knuckles, that's an adjustment. You're basically it's actually called tribonucleation. Yeah, there you go, Danny.
So this sorry, I'm going to cut in here.
Yeah.
That subluxation, that's what it's called?
Or subluxation.
Subluxation.
What do they call it? Like ASMR?
Fuck
or like
the knuckles.
Yeah, let's get into it. Just change our topic. So that subluxation, is that why I see like on Instagram the flashy like videos of people fucking getting their necks cracked and fucking all that shit happening?
Maybe.
Potentially. It depends like on the chiro's like philosophy, right? In terms of like why they're applying those things to somebody.
So you're saying that like that release of gas and that relief of pain sensation is more old school?
No.
Versus new?
The subluxation model is more of the old school.
Okay.
The release of like tension and the release of gases is more the new school. So it's like there's first and foremost, there's no research to support that the subluxation model has any like is a thing per se. Like it doesn't exist.
And like, if your vertebrae goes out of alignment, you're probably going to have a spinal cord injury, right?
Which I don't think is a thing.
No, I don't think it's a thing either. Yeah.
Okay.
I think that whole methodology is a little, what's the right word here? It creates fear and fragility. Yeah. Which I think is a very detrimental thing in our society when enough people aren't moving as is.
Oh yeah. Yeah.
So I like to see myself as much more of like a movement optimist. So getting people to move more and not being fearful to do so is a big part of what I do. Telling people that like, I don't know, whatever your reasoning is, like you're doing this, and this, and now you're like popping things out, and then now you're going to have pain, and then you have to come see me, and then I'm going to pop it back in. Like that just, I don't know, just doesn't seem like the thing.
Yep. It kind of creates like a false dependency too on the practitioner, right? Yeah. Where it's like, you have to come see me 3, 4, 5 times a week.
I'm the only guy that can do this for you.
Yep. I will fix you and then you'll be okay. Right.
Yeah.
Which, that's not exactly how that works. But if you're a subscriber to the subluxation theory, that would be you. That's the kind of thing you'd think that you can do, right? Correct me if I'm wrong there, Rob.
Oh, I don't know. It's like, it's not to say that the people who follow that model aren't helping people.
Sure.
Because I'm sure their manual therapy like is doing something.
Yep.
I just think it's a damaging language to use, and it's a damaging way to like tell people what you're doing.
Yeah.
Just for the sake of like, it makes people feel fragile.
Yeah.
And I don't agree with that.
It's like, I can't move my body because my spine's going to go out of alignment again or something.
Yeah.
Like that.
Yeah. Right. So it's
from a business perspective though.
Yeah. Well, you can make good money.
That's a revolving door.
Yeah. For sure.
I mean?
See, yeah. Now you've read through the lines there, right?
There we go.
Yeah. That's exactly what it is. Yeah.
So,
and back to your your topic on like the online stuff, I mean,
like it's very eye catching, and like I stop and watch it because like it's very interesting.
It's clickbait,
exactly,
and it's the wow factor, right?
Yeah,
because people so often misinterpret like profession for treatment, right? So they think like if I go to a chiropractor, they're gonna adjust me,
snap my shit up, dude,
and that's all they do.
Yeah,
I'm just gonna go and like I see that on like a weekly, if not close to daily basis, right? Like there's like, oh, you're a chiropractor, just can you adjust me? And like yeah, but like there's more I can do for you.
Yeah,
like
for sure.
So I like to go about my practices telling people like I've taken the time to educate myself and become an expert in musculoskeletal health, right? So consider me like the expert guide, but I want to work with you to help you like understand things as well as I understand them and give you the confidence to do things that you need to do based on your specific individual goals, right?
Yeah.
So, and that can be hard sometimes. It's a lot easier to just like, come on in, I'll adjust you.
Yeah.
See you later.
Yeah.
And next one.
Yeah.
Right?
I think that's because people are looking for like a quick answer. Like,
man, 100%. We live in an instant gratification, quick fix society, and it's not people's faults for thinking that. It's because everything online is a gimmick and saying that, right? Like everyone's got like a quick fix for this, and have you tried this, and this is not working, but you want to try my thing, and then
here's this one exercise that'll fix your back pain.
And pay me for
just
it.
$29.99 a month. Subscribe.
Yeah, exactly. So yeah, I think it's not. People have heard things online from somewhere, and that's why they have their belief system. But yeah, I think you can't. Nothing good comes quick.
Yeah. Oh yeah.
So
nothing worth having is going to be a quick endeavor, right?
And a lot of the time, it's not that. And like, I mean, people come to us like whether you're like it's a physiotherapist or a chiropractor looking for a solution, right?
Yeah. Oh yeah.
And it can sometimes get pretty. Like if you have someone coming to you and then your own expectation is like I have to fix this person.
Yeah.
It could be a pretty like what's the right word here? Like unfulfilling way to go about practice.
Yeah, for sure.
Because how many people have like walked through your door and then you can't like really fix them per se?
Yeah, like lots, like
right?
Potentially the majority, right? But you can set them on the right path.
Exactly.
And that's usually about as far as you can get them, right?
So the way I look at it, and this kind of comes from like, we have to do continuing education every year, right?
Yeah.
So I delved into the world of like motivational interviewing.
Yeah.
Because that's good stuff in terms of helping people to create behavior change, which can sometimes be at the root of why things are an issue for them.
Yep. Oh yeah.
You know?
Yeah.
And it helps them come to a solution and a resolution on their own, which is really how you help people long term.
Oh yeah, for sure.
So it gets away from that quick fix and it kind of puts the onus on them.
Yeah.
And I usually tell people like, we're creating what we call like a therapeutic alliance. Like I'm here to help you and be your expert guide, but a lot of the work is going to come on you. So if you want to get better and you want this to go away, whatever it is, whether it's just, back pain, neck pain, whatever, a lot of the work is going to have to come from you.
Yeah.
But I can tell you the things that you need to do.
Yeah.
And I can help you in some ways along the way. Cause like, we're talking about like, active versus passive care. The active care is like what people do on their own, right? The passive care is like come to the clinic and I'll do some sort of like manual therapy on you, whether it's like adjustments, soft tissue work. Some physios or chiros do like modalities like laser or ultrasound or muscle stim stuff or dry needling.
Yep.
I usually approach those things as like the passive care is all about symptom modification.
Yeah.
Trying to make you feel better, calm down your pain to more tolerable levels so that you can implement the active side of things and also take the education and reassurance away from all this in our conversations and then like progress forward slowly on your own.
Yep.
So it's like, I'm the guide, but a lot of this is on you.
Yeah. And like, if they're going to come in, whatever it is, once a week for 30 minutes, there's still a lot of hours left in the week that person has to be in charge of their own vessel. Like
100%.
I had a physio.
I talk about that so often with people. I'm like, it's unrealistic to think that you're going to come here and then 30 minutes of your day, we're going to make
of your week. Yeah.
Right? Of your week.
Yeah.
It's like, we can make small, like probably helpful changes in that time, but there are so many other hours that you have available that you can do so much more on your own.
Yes.
So we need to give you a plan so that in the time that you're away from the clinic, you're doing something productive for yourself, right?
Yeah, which is the opposite of that like fixer philosophy where you have to come see me 4 or 5 times a week to fix you and so you can be on your way, right? It's like, I'm going to give you the tools so that you can drive the car. I'm more like a driving instructor.
100%.
You know, I can maybe pump the brake from my seat every now and then, but like they have to drive the car at the end of the day. You know,
the unfortunate thing, people don't like that.
No, they don't, because it takes work.
I know, right?
Yeah.
Oh,
it's we're just gonna start ranting about our jobs. That'll be the rest of the podcast.
We do things not because it is easy, because it is hard.
It was like
JFK.
JFK. That's a pretty good JFK impression.
That's good.
Should bring that out more often.
Yeah, we're not gonna.
All right.
Do hard things. They're good for you.
Yeah. They're and you know, when it comes to rehab and things like that, like whenever you go see a good rehab clinician, whether it's chiro, physio, whatever, I find that if they don't give you any tools to work on, it's probably not a great clinician that you've gone to go see, right? Because they need to, like, again, there's only so much time that they can give you and you can give them in a given week, because people got lives, people are busy, but you have to get some tools at some point in time and then put in some work, you know? So
you got a lot of books on that shelf over there, Thomas.
Yeah, they're not they're not all mine.
Not all yours?
Not all mine. Yeah.
I thought of that because you were talking about do hard things, right?
Yeah.
You guys ever heard of The Comfort Crisis? Have you heard of that book?
I understand the concept of it, where things have gotten really comfortable. So
everything in our world is designed to create comfort, right?
Yes. Oh yeah. Yeah.
And I don't know.
These chairs, man. Yeah. So I know you go ahead though. Kind of what is the comfort crisis, Rob?
But yeah, that's the whole premise. Is like everything in our lives these days is designed to coddle us and make things easy. But that actually does like a bit of a disservice to us.
Mm-hmm.
You got to do difficult things to make yourself, like, if we're talking about like, you know, health and, you know, fitness, you become fitter because you do hard things, right?
Yeah. Oh yeah.
Goal specific, obviously. Like, you guys are powerlifters. You want to lift heavy weight.
Yep.
You don't get to do that unless you lift heavy weight.
Mm-hmm.
You have to do those challenging things to be able to do what you want to do. But yeah, that's the whole premise, is like, do hard things. They're good for you.
Yeah.
But it's like, I mean, if you want to scratch your bias a little bit, go read that book. It's a lot of fun.
Yeah. Just kind of reaffirm the things I already believe in. Yeah. Which always feels good. Good. Yeah. Absolutely.
Sometimes you're reading it and you're like, this is just so redundant, man. Like, I know this stuff, but it's like, it's kind of nice sometimes.
Oh yeah. Well, it's, you know, you're like, you're like, the thing I believe about, like, or my outlook on the world is, if that's something I can apply to somebody and it creates change in them and helps them, right, by being a movement optimist and somebody that just, you know, is your cheerleader and guide, so that you can kind of push them off in the right direction, right? That can make a pretty big difference in someone's life, versus like, I have the quick fix, I have the magic potion, and then I can give it to you and then you'll be okay. And it, you know, that magic potion thing, I actually had 2 clients in the last month physically say the words, I wish you just had a magic potion for this, right? And it was in a moment of like pretty, like a pretty significant frustration. And, you know, it was one of those appointments where we mostly just talked almost the whole time, where it was listen, like, I understand where you're coming from, and that I've been there. Like, that emotion is totally valid. I want the potion for my knee, you know?
100%.
If it existed, I'd take it. When I you know, we'd be rich. We'd be Nobel Peace Prize winners, you know, just cured pain and all that. But it's never that simple. But if you can, you know, guide someone down that direction, I think that's a big green flag for any kind of rehab professional, right?
Yeah. Yeah. Sometimes people just want to come in and vent.
Oh yeah.
Because you're someone who will listen, give them the time. Maybe they don't have a lot of that in their life. Yeah. And they just need to get stuff off their chest. Yep. And that can honestly sometimes be very therapeutic.
Yes. Oh yeah, absolutely.
Man, I got a lot out there.
Yeah.
And then you just like rinse your face, go back to the room, reset, hit another.
Yeah. Yeah. Back to back. Yeah. Well, even like in the coaching world, like because me and Danny, right, we coach powerlifters as well. And you'll get that, like, you know, you get like an email that's like an essay long, and you're like, oh wow, like this person's got a lot going on right now.
Through it right now.
And they're going, I couldn't get my 4th out of 4 days of training, and this happened, and it's this huge thing of, you know, so-and-so got sick, or my dog, and all these different things. And you're like, all right, like, hey, it's okay. Like, you don't have to always train.
Hey, glass half full. Like, I mean, you get 3 out of 4.
Exactly.
That's 75%.
Yeah.
That's
You're
a pass.
Winning. You're winning.
Yeah, that's a win. Yeah. If you can be 75% consistent most of the time, you'll get a lot of change toward whatever goal you're trying to get to.
Done for sure.
Yeah.
That kind of gives us a good transition here, Rob. I do want to talk about some more green flags and red flags when you're going to see a chiropractor. Like, in your mind, if you're sending someone to see a chiropractor, what are some things that you'd hope they would do for, maybe it's your dad or your father-in-law went to a chiro. What are some things you'd hope they would do for that person that you'd kind of hear about afterwards or something like that?
Okay. Well, chiro and physio worlds, there's something called like evidence-based care.
Mm-hmm.
So that's something that's very important, that people should be practicing that way. And what evidence-based care means, there's kind of 3 pillars to evidence-based care. There is your own clinical experience. So say, I don't know, let's pick a condition like low back pain, for example, because that's
easy.
Something, super easy, super common. So low back pain. So your own clinical experience with dealing with back pain, like things that you've treated people with that have worked in the past versus things that haven't worked. So you probably want to stick to the things that are going to work versus the things that don't have much effect or don't help people that much. So the first pillar there was your own clinical experience. Second pillar is current up-to-date evidence. So things that you're actually doing for people, like if it's manual therapy, like soft tissue release, or like I said, like modalities or adjustments, or, even just education and reassurance. Are those things being shown to be effective at helping this condition based off of like research studies?
Yep.
And then the third pillar is probably the most important one too, is patient preference.
Yeah.
So even if I know that like the research tells me like a low back adjustment is good for mechanical low back pain, meaning like a joint pain or muscle pain, but the person is terrified of adjustments and doesn't want that, I'm not going to force feed them an adjustment, because they're probably going to have a negative response to that.
Oh yeah.
Maybe, sometimes it is just they're a bit fearful of it. But always approaching each case on an individual basis is super important.
Yeah.
And also individualizing the care to their specific goals. Like, is this an individual where, say, they're a 20-year-old powerlifter, or is it like a 70-year-old osteoporotic woman who's like just wants to be able to walk around a pond or something like that?
Yeah.
You know what I mean?
Yeah.
Like, you're going to do different things for those different people, right?
Individualized care, right? Yeah.
Individualized care for sure. That is also goal oriented and specific to that person. And you're just kind of helping them with their problem, not just having some sort of like cookie cutter. Everyone that comes in my door, if you got back pain, I'm going to adjust you and then see you later.
Yeah.
Like, that's not really evidence-based care.
No, definitely not. Yeah.
Yeah. And yeah, definitely, like we've touched on, being like just getting people moving more, because not enough people are moving on a day-to-day basis.
Like globally, 17% of the population, I think, meets physical activity guidelines.
Yeah.
That might be overestimating, actually. I can't remember what the paper said, but yeah.
Definitely low.
Yeah. Oh yeah.
Yeah.
That is insane, bro.
Yeah. Oh yeah. Like,
that is crazy.
And you know what's even crazier is I was reading another study the other day, and it's like, if you meet the guideline, which is not a ton of physical activity, you'll get like about a 30% reduction in all-cause mortality. So dying for any reason, 30% reduction just by meeting those guidelines. Mm-hmm. And it's like, if you had a stock or a savings account that returned 30%, everybody would buy it.
Oh yeah.
But
I usually use the same kind of analogy with like, you talk about all the benefits of exercise.
Yeah.
If that came in like a pill form.
Oh yeah.
Everyone would take that pill.
100%. Yeah.
Problem is, it's so easy to just pop a pill in your mouth. Takes 2 seconds.
Yeah.
Benefits there instantaneously, right?
Yeah.
It's what society has come to expect.
Yeah.
And want. But exercise is difficult. People have lives, people have families, people have jobs, people have to time manage and balance their lives out, right? So finding time for their own physical health usually falls by the wayside. Yeah. And I mean, man, I literally, like we were talking about, some people just come in and talk to us. I literally had this conversation with somebody last week. He literally came in. I haven't seen him in like months.
Yeah.
And he just came in and talked to me about like his inability to adhere to like commitment to exercise.
Right. Yeah.
So he literally just wanted to ask me like how I navigate that. And we talked about the strategies I use, and I left him with that.
Yeah.
I think he wanted me to like treat a couple areas quickly or do a few quick adjustments or something like that. But the main thing he wanted out of me was like, how do I kind of try to start to time manage better?
Yeah.
And we just chatted about that. And I think that was more powerful than anything hands-on I did for him.
Yeah. Well, and like that's like teaching the fisherman or the person how to fish.
Yeah.
Right, versus just giving them the fish. It's the same thing.
I like that.
You can set that person up for success for life. And like the barrier is way lower than I think people believe it to be, because I think people have this image of like,
they build it up.
Yeah, I
like
got to be in there 6 days a week, 2 to 3 hours, getting after it. Ronnie Coleman, buddy style, like it's not the case. Another article came out the other day where they got these people over the course of 6 weeks to do 5 minutes of resistance training per day.
Yeah.
5 minutes. I sit on the toilet for longer than that. And these people, they did one set of a few different exercises. And over the course of 6 weeks, they got stronger. And muscle cross-sectional area, there was changes in there as well.
Unreal.
And it's like,
what was that thing that you brought to, like, you sent an email out about like, what is the lowest amount of exercise we could do and see like a clinical effect?
Yeah.
This is maybe what you're talking about.
That was the same one. Yes, it was the same one.
It's like, how little can you possibly do but still find benefit?
Yeah. And it's like, if we can still find benefit at 5 minutes, well, if like the goal is maybe to eventually get you to the clinical or the physical activity guidelines, let's start with 5 minutes. Even like somebody will come in with back pain and maybe they're like, my doc said it's my weight. And maybe they're a little bit overweight, but they also have a laundry list of medication because their physical health is just declining. They're not doing super great. Retirement hasn't been very kind to them because they just stopped moving altogether. And maybe they're not engaging with anything meaningful in their life and all these kinds of things. And I'm like, at the end of it, I'll be like, you think I can sell you on a 5-minute walk? I'll even start there, and then we'll start talking about why that'd be something that would be meaningful to them. Cause I have had someone say like, I wish I could walk around the block without getting out of breath. And I'm like,
right.
That's a great goal to start with. Yeah. Let's just start there. And it was like, I had a walking program built. It was like intervals of 2 minutes to start. Right. But you got to meet someone where they are and build them up. Right. Versus just being like, if you just keep coming in to see me, we'll do our thing here, and then you'll be on your own, and you won't have anything to do, and you just kind of stay where you are, which is just that's bad practice in my opinion, right?
Yeah, that is a very good point too, because that's a big thing is you got to meet people where they're at, right? Mm-hmm. So another good point of like someone being like a good clinician essentially is like, you have that ability to meet people where they're at, and you know how to say modify loading so that you can stay on track with like their goals, like if it's walking around the block or whatever, but you know how to like decrease the load so they have a starting point and they can feel successful with what they're doing, and then you build on that over time, right? Because the only way to create any sort of meaningful change is consistency over time, right?
Oh yeah.
So you have to get people to buy in, and if they are doing something that is too challenging and it just consistently feels like they're failing, they're not going to keep doing it. Yeah. So you have to be able to like meet them where they're at and dial things back to a tolerable level that still challenges them a little bit, but that they're able to feel successful after. Yeah. And then just like brick by brick, just build them over time. And then they'll be laughing in like 3 months, 6 months about being out of breath, walking around the block. Like, doesn't matter. You can easily build that up over time. You just have to put in the work and do it.
Yep. 100%.
Right.
Yeah. Danny, do you have any questions about what makes a good chiropractor or a bad chiropractor?
Not overly. I'm still processing a lot of this.
Okay.
Great.
Questions in general?
There is another point to this too, is like, even if like I agree with my philosophy towards care, different people need different things. We're all individuals.
Oh yeah, 100%. Yeah.
Some people just want to get adjusted, right? Yep. So if they want to go to any chiro that performs an adjustment and they feel good after, by all means, go ahead.
Yeah.
I'm not going to be the perfect fit for every single person, right?
Yeah.
Some people, I've given people the elevator talk and the spiel and been like, okay, let's get you moving more. Let's do some stuff. And then just like fall off the face of the earth. They're like, oh, this guy's going to get me to exercise. Forget this guy.
Gone.
I hate him. Like immediately, like just not for me.
Yeah.
Or there's like other things out there. Like some chiros utilize like manipulation tools like activators that are
The clicker thingy that we're talking about. Yeah.
that are maybe like marketed as a more gentle adjustment technique. And if that works for you, great.
Yep.
That you found something that helps you, perfect. I don't do that. And if you're hesitant about manual adjustments, like with hands and stuff,
yeah,
I'm not the right guy for you because I don't utilize that tool, and it's just not going to be something we do. So
yeah, 100%.
You got to find the right treatment for the right person at the right time, right?
Yeah, and like that's helpful too because you won't be the right practitioner for everybody, right? You can't be, right?
No.
Like essentially, what I'm gathering from this whole conversation is that there's not a huge difference between physio and chiro.
It's so funny you saying that right now because I was going to ask you next, like, what do you think the difference is? Because me and Rob have just sat here and agreed
like
the whole time.
Like the old, I guess, I don't want to quote it wrong, but like the old style where it's just like a revolving door is just like quick fix, see you later. That's not what you're doing by like at all. Whereas you like have a thorough assessment, you develop a plan of action to treat said injury or a symptom.
Yep.
And you do the exact same thing.
It's I've always said the really good chiros and physios, well, at least the ones that more align with me and Rob's biases or worldviews, I guess.
Yeah.
Or philosophies, that we don't look all that different. Like
pick your adjective. Yeah.
Yeah. Honestly. And
yes,
maybe I've had like a bad.
And this is a question that you get all the time, right? Like I'm sure you get this question in the clinic all the time as well. It's like what's the difference between a physio and a chiro?
Mm-hmm.
There's a little bit of difference in the education.
Yeah.
So like it's physio is a master's program 2 years after an undergrad
in Canada. Yep.
In Canada.
Yep.
Chiro's a 4-year program after undergrad. There's a little bit difference in scope of practice, like where I can order x-rays and ultrasounds, where physios can't. But if you have a evidence-based physiotherapist and an evidence-based chiropractor, and they know how to treat different conditions like neck pain, back pain, Achilles, tendinopathy, etc., there shouldn't be much difference in the way they approach that problem if they're an evidence-based clinician, right? That's how I usually view it. And people ask me all the time, and I'm just like, you just got to find someone that works well for you.
Yeah, just I would say clinicians are kind of like shoes. You know, even like psychologists or therapists. I always tell people, like, if you're looking for one, if one doesn't fit, just go try on another pair.
Yeah.
Like, I'll never be personally insulted if I just wasn't the right guy for you. Like that just happens sometimes, 100%. Right?
100%. You can't take that personally because that's just, you're not going to make everybody happy.
No.
And that's the thing too, is like in every profession, whether it's physio, chiro, medical doctors, even outside of healthcare, lawyers, paramedics, whatever, there are good and bad in every profession. Different people believe different things. So yeah, what matters most in terms of like what's going to work best for you is the person sitting across from you. Professional title means, I think, a lot less these days. The thing you have to figure out is like, is this the right person for me or not?
Right.
Yeah. I dig it.
Yeah, because I think I don't know if I've had like a bad image or a backwards image of chiro, but like it's a lot of the stuff you see online where it's very flashy and and
snap, crack, see you later kind of stuff.
Man,
yeah,
it's just like a revolving, like I said, a revolving door. And
if there's something crazy out there that you've seen, believe me, I've seen it.
Well, what about the I've seen where they do like animal chiropractic work.
Yeah.
I've seen people fucking crack like horse necks and hips and that. Like,
interesting I mean, it's great. 100% works every time because you can't get any feedback, right?
That's what I mean.
Exactly.
You don't know if you did anything, man.
The animal chiro thing is actually veterinarians can take that course.
Yeah.
And chiros can take that course.
Yeah.
But yeah, I have very little knowledge of that.
Yeah.
To be honest with you.
Yeah.
No, it's not like an elective you take at the school.
Yeah.
It's something like it's a separate entity, I believe. Yeah. Like it's a course you pay for.
Yeah.
Probably a couple $1,000.
Yeah.
And learn to treat different animals, I guess. And
for sure. Like as a vet, I could see that being useful in a way, but
hard to judge if the treatment's helping or not, right? Because
exactly right.
You don't have feedback, right?
And then the other one, I don't even know.
But also, who's to say it's completely useless? I can't say either good or bad.
I don't know. Yeah,
that's exactly. I don't know. I just choose not to make that part of my world.
Yeah, that's fair. Yeah,
yeah. I don't know if it's chiro or whatever, but there's a guy. I don't know if it's a guy, but I've seen a couple of videos of like he has like a mallet on the back of the guy's neck.
Oh yeah, man.
And he like fucking hammers him. And and the guy like lays down in pain. What would that be fixing or doing?
Good question, man. I don't know.
Part of any manual therapy technique, even like hitting somebody with a hammer and a chisel or whatever, is you're going to get some distraction. Like the brain's going to get a little distracted.
Fucking big distraction,
bro. It's like, if you...
Mechanotransduction, they call it.
Yeah, mechanotransduction. So if you got pain in one area, I can distract you with like another type of pain. The other pain doesn't seem like that big of a deal because your brain struggles to process all the information.
No fucking way.
So a little razzle dazzle. It can actually be like a fairly effective use of manual therapy. I have found to then get somebody moving, like, in whatever fashion that suits their goals and preferences.
Yeah.
I'm not talking about the mallet and hammer thing. I don't use that at all. But
it's not a part of your toolbox?
No, it's not in my toolbox. No.
It's in your actual toolbox in
but
the garage.
I'm not that good of a chiropractor.
Yeah.
I don't know how to do that.
You can't convince people, hey, just look down for a sec for me.
Yeah. Well, like there's also the impact of client expectations and like clinician expectations can drastically shape the outcome of a treatment. So if like the person doesn't really believe in it, like Rob was kind of saying earlier, like it might not help them all that much, right? Yeah. Depending on the circumstances, right?
Yeah. I always think to myself with like when I see those crazy videos, like the ring dinger is another one that pops up a lot of time and people ask me about that all the time. Like, you seen that guy down in like Texas who like pulls on people's necks and like checks their reflexes after? And I'm like, of course, like think it's something crazy in my world and I know all about it. I'm just like, I really wish I could be a fly on the wall and just hear the conversations that these people are having to get these people to be like to consent to these treatments.
This sounds great. Yeah.
Yeah. It's like, how are you convincing them? Or is it just all fear? Like, it's all just like, oh, I just gotta, let me just whack this back into place. And let me, I don't know. I've always just wondered because I'm just like, how, I don't know. If I was doing that sort of stuff, I don't think I could sleep at night. But anyways, to each his own. And I don't know.
Yeah,
I just don't think I would ever do that sort of stuff.
Yeah. Hey, that's fair, man. I guess many ways to skin a cat, as they say. Rob, I wanted to ask you too, because this comes up like a fair amount. You see it online. Manipulation for infants. Do you think that should be happening, or what are your thoughts there?
Again, that's one of those kind of like specialty niche courses that some people can take. You see a lot of female chiropractors kind of going into the pregnancy, both pre and postpartum kind of health. Like they want to work with those clients. Mm-hmm. I'm not just saying it's just women. A lot of men do it too. But I don't think I would feel comfortable doing that. From what I know, it's very gentle.
Yeah.
There are chiros everywhere who practice that.
Yeah.
I personally don't have much information on it, to be honest with you.
Yeah, that's fair. Yeah.
I know there are some sort of like specific technique kind of schools of thought. Like there's like Webster technique that some women, I keep saying women, but some chiropractors learn both from like in school. Like when we were talking about, that lottery to get into different fourth year, like shadowing opportunities and where they can work. Some clinicians offer like specialized, like, techniques that people maybe want to learn before they graduate from school. I think Webster could have been one of them.
Okay. Yeah.
I remember there being like one clinician who could show you like the, coccyx adjustment. And people would kind of go into those, put them higher up if they wanted to specifically learn that sort of technique. Do I treat infants? No. I think the youngest person I've ever treated was maybe a 3 or 5 year old or something like that.
Yeah.
But no, I don't do that sort of stuff. I refer to other chiros in the city, and if people want that sort of care, then I refer out because I honestly don't feel confident doing it.
Yeah, that's fine. That's fair.
Just not educated on the topic, so I'll just send you to someone who has the education.
Yeah,
you can make up your own mind.
Yeah, and I think the education around the treatment is like a big part of that as well. Because if somebody's saying like your kid needs this because they're out of alignment, it's like that's just maybe not the truth. You know what I mean? In terms of
I think
why they're doing it.
I think there's some things that are probably more sound.
Yeah.
Like, I don't know, you hear things like, okay, some people will sometimes take like real colicky babies to chiros and then their problems all go away. But like, how many went there and it didn't work? You know what I mean?
Yeah.
Like, so right.
Survivorship bias kind of thing.
Kind of, yeah. It's like right thing for the right person at the right time.
Yep.
But I don't know. Sometimes people are desperate. I mean, you got a colicky baby, you're probably trying to look for any sort of solution, right?
Yep.
I'm not just saying it's only desperation. Some people also like think like birth is a traumatic event, right?
For sure.
For both mom and baby.
Yeah.
Sometimes you get like babies with like a torticollis.
Yeah.
Maybe the chiro's doing some soft tissue work or something like that. Maybe it helps a lot. Maybe it makes them less uncomfortable. Like the baby, again, it's like, I don't know how you get feedback on that, but maybe they're just like holding their head better. I don't know.
Yeah. Yeah.
But yeah, I refer to professionals who
fair enough,
have the training. This is actually kind of a good segue. It's like, I don't BS people. Like if I don't know something, I'm not just going to fake it anymore. I think people will much more respect you if you just say like, honestly, I haven't looked at that in a long time, but I know how to get you the answers.
Yeah.
So I will literally follow up on that and I will get them the answer because I know I've been educated. It's somewhere back in the files in my mind.
Yeah.
I just haven't probably revisited it for a long time. So I'll get the answers and then I'll educate them and tell them how to move forward.
Yeah. And then I wanted to ask too a little bit about cervical manipulation as well, because everyone's heard the stories, right? Ooh, cervical manipulation, strokes, things like that, right?
Mm-hmm.
What do you want to weigh in on that with anything? Like, can cervical manipulations cause strokes? Do some chiros maybe not screen for certain things ahead of time? Stuff like that.
Yeah. So to this day, there has been no evidence to support that a cervical manipulation will lead to a stroke.
Mm-hmm.
To understand that, because there has been cases where people have, experienced a stroke after going to a chiropractor's office.
Yep.
So then they basically say like, oh, I went to the chiro's office. I don't know. You don't know the whole story. Like what was bringing them in? Were they having neck pain, headaches? Maybe. But they go to the office, they get a treatment, and then lo and behold, they have a stroke. And maybe it was like, maybe it's a chiropractor they've seen a number of different times for, just, episodic neck pain and headaches. But for some reason, this time it was different. Now, there could be a number of different reasons why that day they had this. So if they were someone who's maybe experienced neck pain and headaches a lot of their life, and they've always found benefit from chiro care, they're probably like, okay, I'll go to my chiropractor and I'll, get some relief from their treatment because it's helped me in the past. I sometimes think that it's either like sometimes you can get complacent and comfortable with people, both from the practitioner side of things and from the patient side of things.
Yeah, bringing up like everything that's going on.
Right.
Yeah.
And so maybe this time there was like, maybe it was a little bit more severe or felt different than last time. Because that's a pretty obvious sign that like something is off here, right? But to my point before, like it's like, yeah, there's been no evidence to support that A leads to B. So the understanding of this whole topic is understanding the difference between like causation and correlation, right? Anybody experiencing neck pain or headaches, there is a correlation between neck pain and headaches and stroke. Because when someone is experiencing a stroke, they can get those symptoms similar to when you're having neck pain or a headache.
Yeah.
So correlation means there's some sort of relationship. We just don't know exactly what it is.
Yeah.
Causation means if you do something, like A leads to B.
Yeah.
So if there was a causative effect of a cervical manipulation causing a stroke, I would never do them again.
Right.
Because there would be a link. You do a manipulation, there is a possibility of a stroke. So you are at no greater risk of having a stroke in a chiropractor's office than you are in a physio's office, a medical doctor's office, checking your blind spot when you are driving your car. All those things I'm just saying the car thing because it's something that everyone does on a daily basis.
Yeah.
But you're at no greater risk of having a stroke because people go to physios for neck pain and headaches all the time.
All the time, yeah.
Anytime you're treating somebody with a neck pain or a headache, strokes have they're probably very far down on your differential diagnosis, but there's not a 0% chance this person isn't having a stroke.
Yeah, for sure.
But to that point, there's a very easy way to rule in or rule out a stroke.
Yeah.
Because if somebody is having a stroke, that is a emergency event, right?
For sure. That's a 911 situation.
Yeah, 911, get an ambulance, unless somebody's with them who can drive them.
Yeah.
But if they're alone, don't just be like, man, you got to go to the ER. Like, drive yourself.
Yeah.
Not a good way to do things. You're probably liable for that person. If you think they're having a stroke, 911 call, send them an ambulance, get them to the right care at the right time, because a chiropractor's office, physio's office is not where they should be. This is something more than just their musculoskeletal complaints.
Yeah.
So, yeah, like to my point, like anytime someone's having neck pain or headaches, there is a possibility that there's a stroke, but there's an easy way to rule it out. Typically, you can ask them about like the 5 Ds and the 3 Ns, right?
Yeah.
So like, what is it? Dizziness, dysarthria, diplopia, dysphagia. So like trouble speaking, trouble swallowing, weakness with those things. The typical things like people know about is like, like asymmetrical, like drooping of the face, or like, and then like the whole like FAST acronym and stuff like that, right?
Yep. Face, arm, speech, something like that.
Time.
Yeah.
There's also VAN as well. Vision, aphasia, neglect.
It's a new one for me.
Oh, yeah.
Yeah.
Danny, not just a pretty face.
I know, hey?
The
I've done a few stroke assessments in my time.
Yeah.
Nice.
Yeah.
And then the ends, like ataxia is like if they're like having trouble like walking, and then like, what is it? Numbness, nausea, nystagmus, I think.
Yeah.
But yeah, you ask them about all these things, and then half the time when you're like teasing those things out, people are just like, oh, no, I'm not stroking out. Like I would know if I was like, doing that.
Yeah.
But there's like easy ways to clinically assess for those things. So
yeah, for sure.
The most important thing, if you are dealing with somebody with neck pain and a headache, is to do a proper history and a proper physical examination. Take the time to actually like get that information so you don't put yourself at risk and miss something.
Yeah.
Right?
Yeah, for sure.
But do cervical manipulations lead to strokes? No.
Yeah.
And also strokes are an extremely rare and infrequent thing.
In general, yeah.
Yeah. There are populations that are more at risk. So obviously understanding those factors and who may be more at risk is important.
Yeah.
Because then if you're like, dealing with the 60, 70-year-old woman with a family history of TIAs or strokes, who's been having facial numbness and nausea recently, flags start to go up versus someone who has much less indications that there's something more pathological and sinister going on here.
Yeah, makes sense.
But most of the information you need, if you are doing proper histories and physicals, can come from there, and you can pretty much tease those things out.
Yeah, which kind of goes back to your point about clinicians becoming complacent a little bit as well, in that this person really well, they've been there in the past.
Yeah.
So maybe you just don't go quite through absolutely everything in terms of a nice, clean, full history and screening as well, right?
Yeah. The logical way I think about it is that the reason people like have the stroke and then correlate it to like the chiropractor doing something to them that caused the stroke is there's something gets missed. Somewhere in the communication, something breaks down. Either the person doesn't want to disclose that this is like something more serious, or the clinician doesn't like, get the information out of the person. Like they're not asking the right questions to like get the minute detail that they need to be like, oh, no, we need to get you out of here.
Yeah, if the person's like, I've been choking on water frequently.
Yeah.
You're like,
yeah.
Okay.
But yeah, just something gets missed. And then, they were probably in what's called like the like prodrome period. Like they were going to have the stroke, whether or not they got treated that day or not.
Right.
But the clinician just failed to get them to the right care at the right time. They missed that it was going to happen.
Yeah.
Didn't get them to the ER, and then they have the stroke. Same day they went to the chiropractor. So they're like, oh, that must have been what happened.
Right. Yeah.
Again, there is no evidence to show to this day that, cervical manipulations lead to strokes. I think the risk, they say, is like 1 to 1.5 million cervical adjustments.
Okay. Wow.
Something like that.
Yeah.
Like pretty, very rare.
Yeah. Yeah. No doubt.
I think when we were in school, we always referenced these papers. I think the author's name is Cassidy. I haven't read them in a minute, but maybe I should read those again.
Sure.
But those were on the, they studied cervical manipulations and stroke risk, essentially.
Yeah.
And from what I remember, that was kind of their findings, that it's extremely rare and infrequent. A doesn't lead to B. The risk factor of having a stroke after a cervical manipulation is like 1 to 1.5 million.
Oh yeah, makes sense. And plus, with those types of studies, is probably like retroactive, right? Not like doing the manipulation and then evaluating under like some sort of imaging or something like that. So if it was retroactive, there can be all kinds of confounding variables that can lead to strokes, right? As well, you can't necessarily tease out and isolate.
Yeah, I think it just comes down to being like a good clinician and knowing when the risk factors are present, giving people the time to tell you the things that you need to know. Just knowing how to protect yourself and protect your patients.
Yeah.
If it's not the right treatment for that person at that time, don't force it. I don't know.
Yeah. Makes sense. Yeah. Excellent. That was a really solid explanation. I've never had someone just lay it out like that for cervical manipulation before. So I've learned something. Danny, how you doing?
Very good. Yeah, I'm sitting here absorbing it all.
Questions?
No. So just so I have an understanding that the whole point of this cervical, I guess, how do I want to ask it? So like the thought is you do a cervical mobilization or adjustment, and that breaks loose like a clot, and then that's what causes stroke. That's
the mechanism.
Most commonly strokes happen as like ischemic strokes.
Yeah.
So something is like, and it could be because of like, like an atherosclerotic like artery in your neck.
It's getting blocked up.
Yeah. Or some, I guess another, outside of strokes, another risk factor that they were concerned about is like cervical artery dissections. So what that means is like, ripping of the artery in the neck.
Yeah.
And
it runs parallel to the upper cervical like vertebrae. Actually runs through the C1 or
There's a little foramen.
Yeah, a little hole.
There's a little kink in the artery, the vertebral artery. And people were always concerned that if you're applying a force to the neck, you're going to like rip that artery. But that's been, again, heavily studied and shown that that's not happening.
That's not the case.
Okay. Yeah.
Okay.
Yeah.
Cool. Yeah.
That makes sense. Yeah.
But
makes sense
there
now.
is like, it's not that there is a 0% chance.
Yeah.
Those things can obviously happen on a very, very rare and infrequent basis. Like that, like I said, that one in 1.5
million. Yeah.
1 in 1.5 million. So that's why it's important to get informed consent and have these discussions with people so that they are aware and they're actually giving you what's called informed consent.
Yeah.
So they know of the risks, they're aware of the risks, regardless of how infrequent or rare they are. They understand that those risks are there. So having them understand that and being a good communicator and talking to people about these things to, educate them is how you would obtain proper informed consent. Because you have to talk about the risk factors.
For sure. Oh, yeah.
And hopefully by doing that, they would offer up some critical information if it was there. You know what I mean? Too, right?
Yeah.
That's kind of the idea. Excellent. Okay.
But for the right person at the right time, cervical manips can be extremely effective treatment strategy.
Yep.
But they're not for everybody.
Yeah.
So individualized care and what do you call it? Client expectations and preferences, right?
Yeah, for sure. It's like that meme where it's like the astronaut with like the gun or whatever, and it's like always has been. Like, talking about that meme.
I don't think I know that one.
I'll pull it up over to I'm talking about this. But it's like someone was like
my algorithm is all Edmund Fitzgerald right now.
Banger.
Yeah.
It's too good.
Yeah, look at this. It's something like this where it'd be like, oh wait, it's been this the whole time. And then the person with the gun behind them goes, always has been. I saw one on a physio account or a rehab account that was like, so it's always just been individualized care. And the guy behind him's like, always has been.
Okay.
That's what it always comes back down to. You know what I mean?
I get it.
Okay. I'm pretty satisfied with where we're at so far in the episode.
This is great.
Any dying or last minute questions that you wanted to get out there, Danny?
No, the big one was the main differences between chiro and physio, which is the whole episode.
I love that we answered it without you explicitly asking the question.
No, we I didn't have to ask.
Just it was obvious. Yeah.
And Dr. Rob here had the most elegant answers. It was great.
Good. I'm glad.
Anything that you wanted to get out there, Rob, in terms of stuff you would like people to know about rehab or chiro or anything there and in between?
I think what I know about like what the research says mostly is it doesn't matter what you do, as long as you enjoy it, you're more likely going to do it on a more consistent basis. And really the only way to create change is consistent exposure over time, right?
Yeah.
So whether it's yoga, whether it's running, whether it's CrossFit, powerlifting, Tai Chi, swimming, maybe triathlons, I don't know, pick your poison. If you like to do it, you're more likely to do it consistently. And that's the only way you're going to get better at it. And that's the only way you're going to get fitter towards that task. Having a good community around you is also a really good, important thing. Like you guys got Bridge City Barbell. That's awesome. It's good to, I'm sure like training sessions with all, your people probably are pretty hype compared to, training in the dark alone.
Oh yeah. Yeah.
So having a good support system is always really, really good.
Yeah, for sure.
That's also another good thing with like in CrossFit. Like they always say, like you come for the fitness, but you stay for the community because people are there all just trying to like seek betterment.
Yeah, that's why people always joke that it's a cult because you just wind up getting.
Oh yeah, man. Yeah. Like drink the Kool-Aid, soak it in.
Yeah, exactly.
Yeah. No.
Hell yeah.
I mean, if you're passionate about anything, I think it always seems culty.
Yeah. Oh yeah, 100%.
Oh yeah.
You know
Especially
what I mean?
to an outsider.
100%.
They're like, what is this crazy ass shit you guys are doing?
Yeah.
Oh, Bridge City Barbell has been called a cult a time or two.
Yeah, for sure. Yeah.
So be it.
Yeah.
Wear that proudly.
Yeah.
For sure.
You guys lift a lot. I see a lot of your athletes smashing good weights.
Yeah, we're doing good. We're doing good this year. It's been a good year so far.
Yeah, we try to help people.
Yeah.
They get stronger along the way, grow as people as well.
Good.
That's always fun.
Good.
Plus, like, you're getting people moving, even though, like, I don't always, like, explicitly say it at the start, but, like, my goals for a lot of people, even if it's just, like, an undertone of their program, is to make sure that they're a healthy, fit version of themselves, right? Because that's going to have long-lasting, long-term benefits that if they're into this stuff now, you can kind of guide them toward, just maintaining that throughout the lifetime. Even if they're not working with me in 10, 15, 20 years and they're doing their own thing or changed paths and maybe they're doing more swimming or biking or whatever, they are more likely to be more active because they've found enjoyment in it in the past.
Mm-hmm.
Yeah.
So
creating lifestyle change in people is tough, man.
Oh God.
It's very tough.
Yeah. I wish I had a magic potion for that. That's what I wish I could just snap my finger and change for people because it's difficult, really, really difficult. We try and do it every day.
I mean, I think that's one of the biggest things I took away from when I started practicing. It was like, man, one of the biggest things you should aim to be able to do is be a really good communicator.
Yeah.
You have to be able to like say things confidently, accurately, and you have to get people to buy in.
Yeah,
and
for sure.
If you don't know what you're talking about and you're pretty wishy-washy with things, then like they're going to lose confidence in you and they're not going to have that buy-in or believe that, telling them to do heavy eccentric calf raises for an Achilles that is kind of sensitive right now is a good thing.
Yeah.
They'll be like, man, this is like kind of hurt me a bit, but I mean, he says it's good.
Yeah.
Should I give it more time?
Yeah,
you know what I mean? Like,
you
got to help people like trust and understand things. And like, I think that comes a lot from like being a really good communicator.
Yeah, absolutely.
Yeah.
Heck yeah. Well, if we start to, that's probably a good place to start closing it out, I think. Hey, Rob? Any other thoughts there?
Yeah.
I love it. Motion is lotion. Move your bodies, people. That's the underlying theme of this one, I think.
100%. I don't care what you do. Just do it consistently.
Yeah. Heck yeah.
It's like adherence is the most important thing.
Talk about this a lot.
Yeah.
Do you know who Eric Helms is?
No, maybe.
He's a powerlifting coach, researcher, bodybuilder kind of fella. He wrote this book called The Muscle and Strength Pyramids, and like just as a way to organize your training principles.
Okay.
And when making a program, and at the base of it, it's just adherence. Because without adherence, it doesn't matter what you have written down because it's not getting done.
Yeah.
And I say it all the time, but like I think fun is a underrated principle of programming.
100%. You have to enjoy what you're doing.
Absolutely, man.
Sure.
Yeah, because that's what's going to get you back in there when you really don't want to be there. Is that something about it is enjoyable most of the time. You know what I mean?
Yeah.
So
people have a hard enough time just making any time for movement or exercise.
Like we've talked about. Yeah.
So like sometimes just take the pressure off a little bit and just go have fun with it. You don't have to compete to your highest caliber every single day. You
Yeah.
know what I mean? Like,
Yeah.
it's like me working around this like nagging little thing I got in my ab or groin or inguinal region, whatever you want to talk about. Like, I'm not training right now I'm not like top tier best version of myself right now, but I know why.
Yeah.
But I'm just trying to enjoy it and just move in ways that feel good, right?
Yep.
Except, kind of contradicted myself because I said I ran 3 times and I hate running. Like,
yeah.
but it's short lived. I know it's
Yeah.
like it's a short term thing, and I'll be able to get back to the things that really bring me joy in no time. But
Yeah.
I just need to give it a little bit of time and a little bit of like relative rest from aggravating activities, and just keep on moving.
Yeah. You just kind of move through and around it. I love it.
Such a good
100%.
outlook to have. Doing what you might not want to do, but this is what you can do.
Yeah. I bet you felt better after you did it too. Like you're like, oh, I actually did something.
Oh, in many, many, many ways.
Yes.
Oh yeah.
Instead of just like sitting on the couch, quote unquote, waiting for it to heal and just like go away, which doesn't always help.
Yeah.
Yeah. Sometimes it just makes you weak and more sensitive. So it's like,
Yeah.
you got to find some way to do something, right?
Yeah. Dig myself out of this hole.
Yeah, exactly.
Yeah, it's actually kind of funny because that's exactly what was happening. I was sitting on the couch and I was like watching a football game, and I was like, "It's a treadmill downstairs. I can watch this football game and get on the treadmill."
Yeah.
So like, just took my phone downstairs and kept watching the same football game, but just ran 5K while I did it.
Yeah, heck yeah.
And then I didn't feel like a complete bum.
Yeah, we've talked a little bit about that in terms of goal setting. It's like instead of always making them like I like the SMART goal style. It's kind of like you can laterally shift your goals to meet a meta superseding goal of like just be a healthy, good human being of some kind. You know what I mean? Like take care of your body, right?
Yeah.
And if running meets that task, right? And there might be other things like walking or taking care of your sleep or your food or your hydration, right? All those things still meet that goal when you aren't able to train the same way, which can still feel super fulfilling versus just like couch potatoing it until like you hope it goes away kind of thing.
Oh yeah. Like, I mean, makes me think about like, going on any vacation and come back to training. That first week back is just torture.
Oh yeah. Yeah.
So you don't want to stay away for too long or else you're just making it harder. You're making the kind of comeback hard on yourself anyways.
Yeah. You just create more friction the longer you avoid it essentially. Right.
Yeah. So you got to learn to maneuver and manipulate around pain.
Heck yeah. Well, maybe we'll have to have Rob back on here and we can talk just literally about moving, manipulating, and through like working our way through pain or something like that at some point in time.
I mean, this is kind of fun. I would not say no.
Heck yeah.
Hell yeah.
Heck yeah. Rob, can you tell the good people here, like where can everyone find you? Like what clinics you practice at, that kind of stuff.
Yeah. So I've been, ever since I came to Saskatoon in 2019, I think I started working with the team at Mackey Physiotherapy in 2020.
Okay. Yeah.
And I've been with them ever since. I work out of both their locations. They have their kind of like first or main location on Arlington. And then I just do 1 day a week at kind of their more satellite location up in Evergreen on Wednesdays. But yeah, I'm the only chiro on staff there. We got one massage therapist as well, but it's predominantly physiotherapists. And yeah.
Because Rob fits right in. That's why.
Yeah. People actually like get confused. They're like, why are you doing physio on me? I'm like, what? You're confusing like treatment for a profession. Like this isn't physio. I'm a chiropractor. I'm just doing this.
Yeah.
What
it's called is rehabilitation.
Yeah.
That's what it is. Yeah.
It falls under the umbrella of manual therapy. And then we're going to get you doing a little bit of exercise prescription.
Yeah,
and
all that stuff.
while we're here, I'm going to educate and reassure you.
Yeah.
And it's
all
just
that.
like, so back to your physio versus chiro question. Like, I don't know. People think
I mean, it's so blended now at this point. I would be confused going in.
Yeah, it's not black and white. It's definitely gray.
Yeah.
And it very much depends on the individual you're sitting across from for sure.
Absolutely. Are you on Instagram, Rob, too? Can people follow you on there? Are you private or?
Yeah, I'm private. I don't have a professional account. I don't know. Back to who's got the time.
Yeah.
I don't find myself that interesting. I don't really want to
yeah, fair enough.
delve into that. But it is a reality of the world we live in, and I do think I should be doing more of that, but
yeah,
we'll get there someday.
Yeah, fair enough. It's a journey, right?
Yeah, exactly.
Heck yeah. Okay, well, yeah, there you go, folks. If you want to find Rob, works for Mackey Physio at both locations, you can probably head over to mackeyphysio.com to book in with him. Because that's where I did it when I went to yeah. Danny, any closing thoughts, remarks, stuff like that?
This is great. I loved having you on here.
Yeah,
It
a
was
lot
awesome.
of fun. Yeah, a lot of fun actually.
Yeah.
Heck yeah. All right, folks. Well, we'll start closing down here. Like I said earlier, if you enjoyed this episode, like, share, subscribe. The more ears we can get this into, the more brain gains people can get, share the wealth and all that. Head over to bridgecitybarbell.com if you have any coaching questions, comments, concerns. You can also follow us at Bridge City Barbell YXE. You can also follow the podcast at achespainsandgains.podcast. You can find myself on Instagram at Thomas Johnston _BCB.
That's right.
Is that correct?
That's right.
I can't even remember my own handle. Is that right? Maybe it is. Danny, where can people find you on the old Instagram?
Heinz _BCB. That's it.
On Instagram.
On
Excellent.
Instagram.
Okay, well, we'll leave it there, folks. See you next time. Peace.